There may be some people here who feel intensely the opposite of the majority of the crowd, but we believe in freedom of speech in this country, and we're going to have a civil meeting. I'm going to treat every one of you with respect, no matter whether you agree with me or think I'm passionately wrong. And I'm going to expect you to treat me with respect, regardless of whether you think I'm passionately wrong. The format is an open town hall. It's my goal to let each of you ask a question if we have time. We'll try to stay as long as we can. There is a limit. There are lots of documents on the table in the back of the room summarizing the various pieces of legislation and giving you information about what's out there. In addition, there will be a question form. If you don't get to ask me your question, or if you just would rather not ask a question orally, then you can use this form and submit a question, because we want to know your questions. There is also what's called a healthcare input form or questionnaire. It lets you tell us, there we go, see my wonderful staff are doing their jobs, healthcare town hall comment form. And it lets you tell me what you think about the Democrat proposals that are out there, about the issue of whether you would prefer to have single payer, whether you would prefer to have patient choice, how you feel about the current system. At the bottom, it asks for contact information so that you can contact us, so that we can contact you in the future with information as the bills move forward. That is an optional blank. If you do not want, if you want to make a comment, fill this form out, but you do not want to give me your email address or your name or your phone number, that's perfectly all right. Fill out the form. We'll read it and collate the results, but you don't have to provide information so that we can contact you again. You can still leave that kind of a one-way street where you reach out to us. On the issue of procedure and civility, what we'll do in just a few moments, I'll finish my introduction and my explanation of kind of the options that are out there, and then there will be 2 microphones, one on each side of the room. Lisa Atkins has one here, and Kim Owens has one over here. What I'd like you to do is come forward in a civil fashion, get the microphone, and we'll alternate one side, the other side. You can make a comment about whether you like the bill or don't like the bill, but don't make a long speech, because out of respect for everybody else, we'd like to get people to ask their questions. Bottom line is civility. There are both uniformed and non-uniformed police officers here. So if anybody decides that they can't control themselves and they can't be civil and polite, I will take that as a volunteering by them to leave. So if you insist on yelling out a question or on being rude or on commenting in an unkind fashion about somebody else's opinion, then you're insisting on your right to leave, and we'll let you do that. I want to say, for any of you that happen to walk out as it gets hot in here and speak to the people on the outside, we apologize that the room isn't bigger. I apologize that it's not colder, but we made do with what we could get, and we didn't really expect this big of a crowd. Maybe hey, it's August in Arizona. When I grew up in August in Arizona, I will tell you this will not be the last healthcare town hall we do. We'll do others, so that this won't be your only opportunity. We will do some by telephone, but we will do more live town halls on healthcare if this issue continues forward, so that you will have another opportunity. You are also free to contact my office at any time and ask questions. And there's contact information on every piece of literature we're giving you. The last comment I want to make is that there's 2 things I want you to know before we start. One is, I appreciate your being involved no matter what side of this fight you're on. And unlike some in this debate, I strongly urge you to continue to have input. Speak out. This is too big an issue to stay quiet. Now with that, we have a flag. I'm going to ask us all to begin by rising and saying the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Did some of you think that when I just walked off it was over? I want to make a comment.
Thank you, Congressman, for being here today.
On the issue, thank you very much. I have one person here who's very special to me, and she's my partner and has been through all this together when I've had the pride of representing you. I would like to introduce my wife, Shirley. Shirley. You should all like Shirley because Shirley's fond of saying John, the short version. All right, now, I'm going to tell you it's too hot up here, so we're getting rid of the coat. Loosen the tie. Loosen the tie. Okay, let's move on so we can get to your questions. First of all, this is the bill. It was originally about 800 pages. It then grew to 1,017. When we marked it up in the Commerce Committee, it grew to 1,026. Before we started the mark, today, nobody knows how long it is on the House version. The reason for that is that there were literally dozens and dozens and dozens of amendments added to the bill, adding all kinds of additional provisions. Lots of them added by the majority party during the markup of the bill, adding lots to it. I don't know, I think Republicans added maybe a half a dozen small amendments that the Democrats accepted. So the reason that you do not have the full bill right now is, this is just illustrative, this represents the amendments. They probably take it to 1,500 pages. But the House Commerce Committee has not yet integrated those. So you cannot go on the website today and get the whole bill. You can go on the House Commerce Committee website, and Lisa, do you have that website? Oh, okay. You can go to my website, click on the House Commerce Committee. There's a button to click. That will take you to the House Commerce Committee website, and from there you'll see House Healthcare Bill HR 3200. Probably most of you know that number by now. It's becoming famous or infamous. And you can then look at the full bill. That will give you the big stack. If you want to look at the amendments that have not yet been integrated, you can look up the amendments, but you will have to yourself collate them together. Not an easy task. With that, let me just start with a quick explanation. Many of you are familiar with lots of provisions in the bill. Functionally, it is as it has been described. It does have, for example, an employer mandate. It does have a penalty if your employer does not in fact provide coverage. It does have an individual mandate. It has a penalty if you do not buy coverage. It does have a provision that says that every single health care plan sold in America in the span of 5 years, roughly, has to comport with a number of new mandates covering essential benefits, minimum coverage, what you can cover, what you have to cover. For example, saying you must cover mental health parity, you must cover drug abuse counseling, and on and on and on, all the way down into and including a new appeals process that must be included. And this is my favorite, it has a provision that says if you're an insurance company in America and you want to advertise your plan in the future, you can only advertise it pursuant to guidelines promulgated by the federal government.
speech, all right.